Now, we have heard about several potential coronavirus treatments lately. First, it was heartburn medication, most recently Pepcid, although it had to be given intravenously. Male patients possibly given estrogen. Then came Pfizer and its announcement that it could have a vaccine ready by the fall. And also Gilead Sciences in the new study showing the antiviral drug remdesivir could speed up patients' recovery time. So what's the most promising out of these treatments? Joining us now to weigh in our panel of medical experts, we have former White House physician and chief medical officer to President Trump, Dr. Ronny Jackson. Dr. Jackson is currently running for Congress as a Republican in Texas's 13th district. And also with us this afternoon, Dr. Niket Sonpal, an internist, I can't say it, but also residency program director. You all have, you gentlemen have too many accomplishments. I can't even read them all. So I'll start, since I botched your introduction, Dr. Sonpal, I'll ask you, what have you seen that's the most promising so far?
So in my opinion, I think the big one that has really made some hope come alive is remdesivir. We know that the study was government funded. It showed that the coronavirus time to improvement and recovery time was brought from 15 to 11 days. We also know that it's not a cure. We also know that it's promising because it shows that there's a proof of concept that we can block the virus. Now, what this means is that people are going to jump and think social distancing, hand hygiene, I can come out and play, but it's not quite the case. We also know it doesn't reduce death. 8% of the people who took remdesivir did expire, while 11% of those who did not. So even though that's a 3% difference, it's not statistically significant. What I think the remdesivir trial shows us is we're heading in the right direction, but prudency is going to be very important at this point.
Dr. Jackson, what do you find most promising right now?
I totally agree right now. I think remdesivir shows the most promise right now. I think it has some issues. One is, like was just stated, it's not going to be an end-all. For one thing, it's administered by IV right now. It's not an oral medication. I think, if you try to make an oral medication right now, it has some issues with the GI system as it passes through the liver that deactivates it. So it's really restricted to IV use right now. So that means only patients that actually have coronavirus are going to get it. Now, it could make a huge difference. It could really reduce the morbidity and the mortality of this disease and be a big game changer, especially if this comes back in the fall. So I think it holds the most promise right now, but I think there are a lot of drugs out there that are being looked at. Some of them we probably haven't even heard of yet. We still haven't shut the door on hydroxychloroquine and, azithromycin and famotidine. It's still being looked at as well, the Pepcid drug. So there's a lot of things out there, and there are people all over the world doing this, not just in the United States right now. Somebody's going to find the silver bullet for this that's really going to make a big difference, and it's out there. We just have to find it.
Dr. Sonpal, how does a vaccine work, if you could explain to a layman, versus treatment?
Of course. So a vaccine is primary prevention. The whole goal of a vaccine is to introduce a component of an antigen or a component of the virus or the bacteria that then induces your immune system to create short-term and long-term immunity.
But isn't the immune system one of the things that backfires on you with this particular malady?
So in this case, there is a component where there's a cytokine or a component of our immune system that does ramp up and cause damage to the lungs. However, with the actual vaccine, the vaccine is a part of the actual virus that would be inactivated, and all it would do is almost in a way trick the immune system into creating immunity without actually creating all of the other side effects. Very similar to how we get a flu shot every year, or people over the age of 50 to 65 get a pneumonia vaccine.
Dr. Jackson, there's a new report out of the University of Minnesota that says that we could be dealing with this pandemic for the next 2 years. Why is that? And does this come down to that concept of herd immunity?
Well, yeah, herd immunity is going to be a big factor in this, and we don't know exactly how big a factor it's going to be yet. Obviously, if we had some component of herd immunity that was propped up by the fact that we had a vaccine and we could give people vaccines and they could develop the antibodies to this, so that they were protected. And then we had a certain portion of the population that already had the virus, that got it under normal circumstances, had the antibodies and were protected. Then that would really bolster the herd immunity argument, or the herd immunity capability to prevent this from coming back. So I think until we get a vaccine, we're not going to have the levels of herd immunity that we really need. But I think that, this is this is a novel virus. We don't know a lot about it. Initially, folks were saying, some of the people that were doing research on this, that it wasn't mutating very much, which is a good thing. That means that if we do develop some kind of vaccine, if we do, which we will, if we develop a vaccine for it and if you get it and you develop antibodies to it, you might be protected for a long period of time. We don't know the answers to those questions yet, but we're hoping that it's going to be some extended protection once you get it. We're hoping that we get a vaccine in a really timely fashion, and those both together lead to some really profound herd immunity. Dr.
Jackson, thank you. By the way, love the background, but you do need the Lone Star there somewhere in the background.
Yes, sir.
You know that.
Yes, sir. I'll fix it.
And Dr. Sonpal, thank you, gentlemen.